Healthcare in the US is expensive, and there's several different reasons for this. I'm going to go into several, but this is going to be a multi-part series, and there are three big reasons that I can see off the top of my head and that I took a few notes on that I'm going to share. Number one is the industry itself. The industry being private insurance companies, medical device companies, hospitals, etc., etc. All of these entities benefit from ever increasing costs of services and ever increasing prices for things. So for example, a medical device company can increase its revenues and its profits if the cost of goods continue to go up or if they have more efficient operations. So that's one thing that contributes to this. The second thing is the industry itself of private insurance companies. Now, private insurance companies, the large ones and the small ones, they are beholden to a rule from the Affordable Care Act called the medical loss ratio. And what the medical loss ratio says is for large insurers, they have to spend 85% of premiums collected, premiums being the money that you and I pay into the insurance company, and they have to actually use that money to pay for medical services. Now, you might say that, well, that's a great thing. They only can profit 15% based off of that. They can only take 15% of their revenues to use for other purposes. Profit will be a little bit different depending on what their overall spend is. But the problem with this is that the only way for an insurance company to make more money is if they end up spending more money. So like, for example, I pay $1,000. If I pay $1,000 a month in premiums, well, they have to spend $850 of that somewhere, right? Now, it doesn't change. Like, let's say that I'm now, they can't make the decision to pay less than that. Therefore, taking more of that as profit and being more efficient, they have to then charge me double, which, by the way, is happening. They're like, let's say your premiums were $1,000 a month, then they go up to $2,000 a month. Guess what? Now the insurance company, they still have to pay 85%, but they're just taking in more overall revenue, which is just increasing the cost for everybody. And yeah, it is a major racket. And I'm not even going to go into the pharmacy benefit manager companies and all the vertical integration happening in healthcare. I'll cover that in different videos. Vertical integration being United Healthcare and Blue Shield and Blue Cross buying like clinics, they're buying provider groups, they're buying pharmacies, they're all these things, and they're essentially like paying themselves, which is a weird shell game in itself. So those are a couple reasons. And then the other one, and people aren't going to be happy to hear this one, but we also have a very unhealthy population. More unhealthy than other countries. And it's often said, you hear all these reports and read these or watch these videos about how the US, even though we spend more money on healthcare every year, we are one of the most unhealthy of the developed countries. And I don't think it's a spending issue necessarily. It's more of a cultural issue. Like, think about all the roads that we have and the huge cars that we drive and the non-focus on physical activity for most people. Like, there's just no incentive for people to be physically active. And it's actually, there's a whole other industry that is unintentionally trying to get us to overconsume things. So social media companies to overconsume our attention. Food companies trying to make us overconsume food with really, really non-satiating but really delicious and tasty foods that we eat too much of. And Uber Eats and all these things that make life so convenient for us, they actually lead to us being more unhealthy and then spending more money on healthcare services. So I don't know that it's a great even take to say, well, we spend more, but we have worse outcomes. I think it's more, that's kind of, I don't know that those really impact one another too much. But I digress. We've got our industries, so all the different companies that are trying to make money, hospitals included, that also overcharge. And there's a huge shell game that's going on, or not a shell game, but like this weird, just shadowy pricing crap that happens with hospitals and insurance companies that I can cover in a different video. But ultimately, those three things really contribute to a lot of the rise in healthcare costs. Because if you have an unhealthy population, guess what? You're going to get sick more. You're going to have to go to the doctor more, go to the hospital more. You're going to have more procedures that cost more money. If you have private insurances that the only way that they can make more money is to charge more, then guess what? They're just going to keep charging more and increasing the price, and it's going to go up for everybody, and everybody's going to have less money. And then again, hospitals and clinics, everybody who is selling a medical device, like this has the potential to also increase costs. Like new medical technology is expensive to develop, but oftentimes it's just like way overpriced and then sold to hospitals at this like massive upcharge, so, or a higher ticket price than they would normally charge. So those are the main issues with why it's so expensive. So the solutions are complicated, and I'm not going to get into a ton of detail in this video. I will in future ones in this series, but big picture, I think that we need to really look closely at the regulation for private insurance companies, because if we consider retracting or redacting that component of the Affordable Care Act that puts a cap on the revenue, or or tells insurance companies how much they can spend on healthcare premiums, or from the collected healthcare premiums. I think that's one way that could potentially reduce the overall healthcare spend. Additionally, there's a movement to just eliminate all private health insurance companies and instead go completely employer sponsored, which basically cuts out the middleman. And like you and I, through our employer, we go directly to the doctor or directly to the physical therapist or whoever, or into the hospital, and pay them directly, cut out United Healthcare, and that reduces, the 20-25% cost associated with the middleman. This, I think, is possible, and it is happening, but there's a lot more work that needs to be done, and that also has or can have downsides as well. But fully or self-funded companies, that is a great way. Having like direct contracts with hospitals and such is a great way to actually cut down on costs too, and make care more affordable for everybody. Has its risk as well. And then in terms of an unhealthy population, I mean, personally, like there are more gyms and personal trainers and people out there who are giving free advice on how to make yourself healthier. Like, you don't need to pay anybody to get correct information and like good information on how to be healthier. Like, we already have the information. And so the problem is really an execution component of it, because people are working a lot, there's a lot of stress, they're bombarded with ads for really delicious food all the time, they're driving a lot to work, there's not actually any built-in reasons to get out and walk or get out and work out. There's nothing built into the day for people. And this is very counterintuitive, or just counter to how we evolved as humans, because prior to even like the 1950s, like there weren't a ton of highways and most people worked pretty close to home. And so you had to either walk or ride a bike or, get to work in some way where you're being very physically active. And so people were much more active. In addition to that, like prior to like the 1970s, there wasn't like snacking. Like snacking wasn't a thing. We didn't have the snack industry. We didn't have, Frito-Lay running ads for Doritos during the Super Bowl, reminding us that we need to eat that, or like Coca-Cola. We don't, right? Like we didn't have those things, and we didn't have the devil on our shoulder telling us that we should go and get that, right? And again, I love having a Coke and like some Doritos and some hot Cheetos every now and again, and Oreos, and I think those things are great. But the problem is that we don't do a very good job of portion control, and we don't do a very good job of impulse control, especially when we're tired and sick and just overall deconditioned. So these things make it very difficult to actually make any progress. Like an unhealthy population, it's not going to change unless we're able to address most of those things. So one thing that I think can really make a big difference in this is changing how we design our cities and make central gathering places again, to where people can actually walk places in their communities. They don't have to drive everywhere. So having like community markets and coffee shops and dog parks and that type of stuff, making it safe to walk around, and enjoyable, and also have a purpose behind going places. Because like after I shoot this video, I'm going to walk around the hospital as my exercise, but there's no like, there's no goal for that, right? I'm not like walking to get groceries. I had to consciously choose to do that, and I do it most days, but that's not the majority of people. The majority of people are not going to do that. And that's just the reality of the human condition. And so instead of like telling everybody, oh, you need to do this and be better about this, it's like, well, okay, we know that's not going to work for the majority of people. Let's do something that works for the majority of people, which is redesigning how our cities are laid out, redesigning how our built environment is. And I think we'll have a much larger success rate in actually getting people more physically active. And then also, I'm not a huge fan of regulating everything, but maybe we have to regulate what sorts of ads we can run for different snack foods and things that are just like very unhealthy, that are not actually making us a stronger country. Like the fact that we have a lowering birth rate, people are making less money, and so like a purchasing power parity is lower, and we're sicker than other developed countries. Like if our country is not healthy, how are we going to compete in the future? Like real talk. Like how are we going to compete in the future if everybody has diabetes and cardiovascular disease? Like it's not a great like public safety or national security. like it's not good for national security if everybody is sick and unhealthy. So I wish that as a country we would look at that, and as a society we would say, wow, yeah, I mean, that's pretty accurate. Let's put things into place that actually prioritizes our health, and anything that is going to make us like less healthy as a country, let's not do that. But I think a barrier, I'm just rambling, but a barrier to that is the fact that the food industry, the healthcare industry, and advertising industry for that matter, social media too, tech, I mean, these are massive industries and there's tons of money in it. So it's very possible that if we regulated these industries and actually like kind of hamstrung them a bit so that everyone could be healthier, that our GDP could potentially go down, at least in those industries. And they don't want that, right? They want to make as much money as possible. They don't really care about if people are healthy or not. Like, individual people at companies do, but if you're a publicly traded company, you're there to make more money. You're there to make more money and like do what your shareholders want. That's just the reality of it. So, you know, it's a challenging thing, but I think we can move in the right direction if we say as a country, yeah, like our health is more important than, and like our well-being is more important than our GDP. Or we need to like measure, we have to have like a secondary global measure of like the well-being of a country. And it shouldn't just be GDP. It needs to be GDP plus, like, I know there's like the global happiness index, there's various other like well-being indices, and we should probably consider using one of those. Anyways, this is just a long ramble of, you know, one of many that I will continue in this series, but thanks for watching. Would love to hear your thoughts. If you have any other ideas as to what could be implemented to improve the overall health of the US, or if you live in a different country and different initiatives that your country has taken that has helped actually improve the health of the country, would love to hear that. As always, thanks for watching. Have a strong day, and I will catch you later.